If you'd like to call our studio, here is the number. Call the direct line on 4533911, or you can WhatsApp call on 4879849. Call to participate, win prizes, request music, and interact with our announcers and DJs. Real FM, the People's Station. The People's Station.
And welcome to another episode of Public Health Insider. Today we are discussing universal health coverage. We are back on this topic, universal health coverage. Today I have with me a familiar face. He's been on the show before, Mr. Josue Prevalus. He is the project officer with UHC. So welcome to the show today, Josue.
Thank you, Jay. Good morning to our listeners and viewers.
Okay, so today we will be discussing a little bit more about UHC. So I would like to just give you a quick recap before we delve into the matter, so that you have a fuller understanding of where we're at and where we're going as a team. Universal health coverage was first launched on the 1st of June 2022 under this administration through the Ministry of Health, Wellness and Elderly Affairs. The launch coincided with the launch of the first service, which would have been maternal and child health services. Many of you would have seen that happening at Constitution Park, and since then, expectant mothers have had the opportunity to get their lab tests as well as their ultrasounds at no cost to them. Now, when we say at no cost to them, that is what we mean. We mean that expectant mothers do not have to pay out of pocket to get the services under universal health coverage. Now, there are many services that we have launched since then. And as a whole, it's called the Essential Basket or Package of Health Services. And with this, it took many technocrats, it took many doctors, it took many experts to come together and see what ailments, what diseases, what illnesses most affect St. Lucians. What affects St. Lucians? So it would be things like cervical cancer, it would be prostate cancer, it would be diabetes and hypertension. We also had issues with breast cancer, the high prevalence of breast cancer. We know that that is the number one killer of women here in St. Lucia. So with that, the government of St. Lucia and the technocrats and the stakeholders decided on this basket of services that they would give healthcare at no cost to the individuals who are affected by the diseases or by the illnesses or by the non-communicable diseases as well. So that is where the Essential Basket of Health Services came from under UHC. But that is only one component of UHC. Universal health coverage covers more than what we say, hey, you get this at no cost and you get that at no cost. We will delve into that a bit deeper on other shows, but today we want to talk about the benefits of universal health coverage thus far. How has universal health coverage benefited the people of St. Lucia? And if you are unaware of it, we want to make you aware of it so that you can then take advantage of it so that you and your families can live a longer, healthier life. So with that, Josue, could you just give us a rundown of the services and how they're performing thus far?
Thank you, Jade.
Sure.
I think you have outlined, did a good introduction on everything that UHC have been doing under the Ministry of Health. The ministry really, with that initiative, as you clearly stated it, from June 2023, we started with maternal and child services. And as of today, we have served more than 3,000 women. And these women are women who have received 3 ultrasounds as minimum during their pregnancy, and also all the basic lab tests required for the pregnancy. And you will have known as well, before that, there would have been the child care services exist at the health centers. So therefore, when the baby is born, the follow-up can continue because that service will have been existed before.
All right.
So now we also launched, recently, well, if I take it in order, it will be men's health clinic, the relaunching of men's health clinic that the ministry has done in December 2024. And when we speak of numbers, I want persons to understand, when we speak of screening, we will tell you, for instance, more than 1,200 men have been screened. Now, when you look at, as we go lower, you see how many new clients were coming in, you say 904. And then the balance will be those who require follow-up, come back for the follow-up. And for clients who were required to do a prostate antigen test, that's the PSA, that's we have been promoting out there because of the sensitivity of the DRE exam. Most men stay away from doing prostate screening because of the DRE, that's a digital rectal exam. So therefore, the ministry came up with that new technology where you use a PSA to process to do that screening. Therefore, it create more opportunity that avenue that moment comes in. The moment come and they receive the test, and that has been going on pretty well. And for biopsy, we have biopsy services available as well at the men's health clinic. And yes, it depends on the health condition of the client. I tend not to call them patient. I call them client rather.
Yeah.
So you will see there was a number of 65 clients were referred to see a urologist. Coming from 1,200 screening to 65. That's good. So you will see why only 65. It means that the less persons who referred to the urologist is better for us.
It's better for us, yes.
Because the screening, that's what we're looking for, ensuring that persons are healthy and they are within the bracket, the norm. For them to be healthy. So the lower the number is to go to the urologist or for biopsy or see the urologist, it's better for us. This is how we have been able to achieve our goal, which is the screening, prevention, and promotion, which we are doing right now, and treatment. I'm hoping that we don't reach there, because if it's treatment, that means something bad happened.
Yeah.
You understand? So we want the promotion, that prevention, and desensitization work better than to prevent us from going into that treatment phase.
Okay.
If I reach to one of our recent one would have been the mammogram services, which is breast cancer screening, where women can go through the wellness centers. We encourage all persons, organizations, whoever wish to access any of the services offered under UHC to start from the nearest wellness centers. The reason why it's not to as we'll use that language to macro. That's not the thing of minding your business, but the ministry wants to access data. The more access we have to data, is easier it is for government to make decision. Therefore, if there is no data available, we don't know. That's why we keep saying for a number of years, men have a lower health-seeking behavior.
Yes.
Because they are not going, there's no data, there's not enough data available on their behalf to make decisions when it comes to men.
You hear that, Nigel?
So therefore, if men, just like women, will have gone for anything, symptoms, they feel like, you know what, let me see the doctor. Then there will have been a system created to allow data to be available. Therefore, when a decision has to be made, then there's data to say, okay, to support that, and government then will finance it. Right. If there's no data available, then we give government the right to say no to something that we don't have data for. And
I would assume that if you are trying to establish universal health coverage, it is not something, Dravid, you might want to get this. It is universal health coverage is not something that you can come up with overnight.
Correct.
Universal health coverage takes time. Like you said, it takes data. It takes analysis.
Correct.
It takes consultation. There's a lot of paperwork, to say the very least. So with that, I know that UHC has been working diligently. They've been going into communities. They've been sensitizing people from the churches, spotting groups. They've been sensitizing people who work in hotels, you name it. Just general people in the public so that they have a better understanding of universal health coverage.
Correct.
Like I said earlier, the essential package of health services, where we say this is, you get this service at no cost, or you get maternal, or you get cervical, prostate, or mammography at no cost. It's just one component of UHC.
Definitely.
UHC is going to impact St. Lucians
On a broader
widely,
scale. Yeah.
on a broader scale. Thank you. And it is important for us to decentralize healthcare. We have two main hospital facilities on the island. That would be St. Jude Hospital and the OKEUH. And with that, you find that there's a high influx of individuals every day accessing care, advice, emergency care as well. So when you want to come in for a simple screening, a breast cancer screening, and then you have to wait hours, it's because you have to bear in mind that there are only 2 hospitals in St. Lucia. But with universal health coverage, our focus is on primary health care. So you access all of the services at your local wellness center, just down the road. You take a walk down the road, you go to your wellness center, you ask them, you say, hey, I'm interested in prostate cancer screening. And they will give you the day and the time that you should return to get the test done. And that is how you remove the burden on the main hospitals in healthcare facilities, and you place that at the various wellness centers. But you also empower the wellness centers by training the staff, by giving them the equipment they need and the support that they need, so that they can administer care to individuals. And then universal health coverage can, as well as finding data, but they can also ensure that the people of St. Lucia get the care that they need, and it's preventive care. So they catch these things early. They catch with the breast screening, they catch it early, breast cancer early. With the prostate test, they catch the prostate cancer early, and the list goes on and on. That is how we are achieving universal health coverage. It's not just a fly by night. It's not a promise. It's not pie in the sky. It is a fact. And it is what is actually going on since 2022. Universal health coverage was established then, but it is steadily growing. It's on a upward trajectory, because the work is being done and the efforts are being done to ensure that people in St. Lucia have a fuller opportunity to get good health care, is what I'm saying. So Josue, sorry I interjected there. Tell us a bit more about the breast cancer stats for now.
For just as you were outlining it, UHC it takes time.
Yes.
Many countries, even advanced or developed countries, for like Japan, they have been in the business for 20 years to implement UHC, and up to now you can say they are 95% completed. In terms of service delivery, digitalization, and financing. These are the 3 really background foundation to implement UHC. Therefore, for people who have doubt, will understand they have doubt, because even bigger countries, they take time for it to process, to get the population, to get the buy-in from them. We are fresh, we are young babies in the business, you understand? So therefore, we will assertively keeping the population updates to PHI, and with all the steps moving forward, we'll tell them. For start on cervical cancer screening, we have service since August 2024. We've launched that service. We reach now probably, if from August, that's the last data we had, at more than 3,000 women were screened.
Wow.
And if we look at how many of them were eligible for biopsy, we had a number of 296 women to do the colposcopy.
Wow.
Yeah, and 25 of them were eligible to do biopsies.
Okay.
So again, more than 3,000 women screened, only 25 of them did biopsies, which means that it's good for us. That's good news.
Yes.
Doesn't mean that the number from the 226 to 296 who did the colposcopy, yes, the result will be coming in. However, the lowest we have again on biopsies, that's a key message we want the population to understand. So the less people go into the biopsy, it means that for us that we have good news.
Right.
The prevention is working, the promotion is working. So to avoid us going from the treatment phase where somebody diagnosed from stage 1-3 cancer.
Okay.
You understand?
And the services are there. So, for example, this month is Breast Cancer Awareness Month, and we're really pushing it, and we're asking people, we're pleading with the women to go out and ensure that you access the service through your wellness center. That is the only way that you can get it at no cost. So if you walk into a hospital today and you say, I would like my breast screening or a mammogram done, they will say yes. However, you would be required to pay for that service because you are accessing it directly into the hospital. But when you, like we said, we're decentralizing healthcare. When you go to your wellness center, you get given a voucher. Am I correct?
Correct.
And then you go to the hospital. You submit that voucher to the hospital, and then you get your breast cancer screening at no cost to you. So save yourself the monies, save yourself the energy. Go to your wellness center, it's in your community, and then get your referral for your breast cancer screening. And this is not just for this month, which is Breast Cancer Awareness. This is not just for October. This is indefinite according to the government of St. Lucia. So this is what we're doing to ensure that the people of St. Lucia get the care that they need.
If I may add something, Jade.
Sure.
And for breast cancer screening, I want to inform the population, update the population on only St. Jude and Hospital performing the mammogram and the ultrasound. So because they have that 3D machine,
Yes.
and therefore the ministry has chosen these two to provide that service. So we want the population to be aware of that. So therefore, whenever we speak of mammogram, if you want it to be at no cost to you, and you have to access it from the wellness center, then based on the physician diagnosis, you will be referred for mammogram or ultrasound at the hospital, at any of the hospitals.
Okay. And then the other thing that I really wanted to touch on was the cost of the services that we offer. This was something that's very, very close to my heart because I believe that people are unaware of just how expensive healthcare can be. Did you know, St. Lucians, that if you are accessing care through your local hospital or medical facility, or if you are on dialysis, the cost of dialysis can go upwards of $65,000 a year? Did you know that? That it can go upwards of $65,000 a year? It's really, really something that you should consider, particularly in these times. Now, when we look at maternal and child health services, the lab test that comes at no cost through UHC currently, that lab test would be $590. That is the average cost of the lab test that you would be accessing as an expectant mother. Your ultrasounds, it's a base cost of $100. That's just the base. Some of us go to the different labs and we get it for $200, $175. You know how much these things cost. But the average cost would be about $130, sorry. Then liquid-based cytology, if we move down, it would be $65. And then HPV testing is $75, an average of $75. So if you would like to do your pap smear, these are the base. That's just the baseline of what we'll be paying. We're not even including the cost to visit your private physician. We are simply speaking about the tests themselves. So these are the savings that you are making. And I must go back to maternal and child health. The ultrasounds, you would need them at least 3 times during your pregnancy, at least 1 per trimester.
Considering you have a healthy pregnancy.
Considering if you are, because there are people who need it.
Yes,
like,
I have many cases.
Yes, when I was expecting, I had ultrasounds every other week. And my visit and ultrasound would cost me almost $400. This is twice a month. That's $800 is what I would pay. What we are saying, through universal health coverage, you do not have to pay any of that because you will be referred through your wellness center to get those services at no cost. It is important to just really understand what's going on here. For the men who would want to check their prostate, the lowest amount that you would pay for your prostate screening altogether would be $310. So the PSA level test would be $50, the prostate ultrasound $100, urology review $60, biopsy procedure $50, processing of the sample another $50. We don't have the visiting here, and the prices may vary from facility to facility. So that is why we're trying to make things a little better. The government of St. Lucia, through the Ministry of Health, is trying to make things a little better for you, the St. Lucians. And I could go on as well with breast cancer screening. You would pay a minimum of $685. So the screening services are $160, the 3D mammogram $175, your ultrasound and follow-up $100, biopsy procedure $200, processing of biopsy sample $50. So all in all, you'll be paying a minimum of $685 for your mammogram, right? And it could be way more than that. Like I said, the price varies from facility to facility. So it is important to take advantage of these services that are being offered under universal health coverage, right, Josue?
Correct, you're right. And so far we have provided mammography services to 178 women.
Okay.
That including both hospitals, St. Jude and MHMC. Also 28 ultrasound were processed.
Okay.
In the same number, how it happens, you will understand that the mammography, when you do it, it may or may not warrant an ultrasound, because the mammography is a low mode X-ray, and then for the ultrasound you will go deeper for a mass. For instance, the doctor will need to see what that mass is about. The ultrasound will be then performed for a better visibility.
Right.
But with a mammogram, looking at the entire breast. So therefore you will see the difference. The 28 will remain lower. Not everybody from the 178 women were wanted to do an ultrasound for the breast. Yeah.
Okay.
It hasn't been good.
Oh,
Yeah.
that's really good.
Definitely.
And this is our latest service that was launched on the UHC, which would be breast cancer screening services.
Snake
Snake bite as well.
Okay.
Yes. As for snake bite, this is a very special one because I'm seeing some big hefty costs.
You understand?
Yeah. I'm seeing for the labs, inclusive of all labs for one day, you pay $967. 3 days of treatment of labs would come up to $10,564.
That's expensive.
Yes, the antibiotics alone are $380. The ultrasound $100. Hospitalization cost is $100 daily in a regular ward and $300 daily for ICU, and you'll most likely be in ICU if you get bitten by a fidelis. Okay, Nigel. Then OEC review $60, physiotherapy review $75. So that's a lot. I didn't calculate the full amount, but you will be saving a lot if in fortunate circumstance that you happen to get bitten by a fidelis. And the reason this happened was in conjunction with the Ministry of Agriculture as well, because you know that a lot of our farmers they are exposed to the deadly fidelis snake, and it is important to consider each sector when you are thinking of healthcare, because healthcare impacts everybody. When we say UHC, we mean health for all. Therefore, you want to ensure that the care that you are giving impacts everyone. So this was our contribution to the farmers, and not just to farmers, because anybody can find themselves somewhere in a bush, I don't know. But yeah. Nigel. But that's not what I meant. I meant, you anybody can find themselves in a precarious situation, and they could be afflicted by that venomous species, right? Okay? Yes, better. So that is why we're trying to encourage individuals. What happens if they're bitten by a fidelis? What's the first step? What do they do?
The first step, we encourage them to You know, because of the location of most of the snake bite happens
Right.
while they are in the bush or early wee hours in the morning. So therefore, the first instance is to contact the ambulance, call the hospital, inform them, and we also advise if you happen to be bitten by a snake, if you have a neighbor who has a vehicle, for instance, we can drive you around. That will be our fastest move to do. But we advise persons to contact the hospital and call for the ambulance, and the ambulance as well. They were part of all the training destination we have been doing,
Yes,
so they are
they
fully
were.
aware of the protocol.
Yes.
And that's that. Once you go, the ambulance come for you, go to the hospital. As soon as you get there, you will be taken care of as it should be. And the antivenom will be administered to you, 1, 2, 3, whatever amount you need, it will be provided to you, and then the ministry will be billed for that.
Okay.
So the ministry so far, since we launched that service, we have covered 5 snake bite
Okay.
between the 2 hospitals, St.
Okay.
Jude and OKU. So a total of 5 cases were happened, and the ministry has covered for these 5%, and they are all fine actually.
They all survived.
They all survived. No
Okay.
amputation required. One of them, I think the highest we had was 3 days admission, and the other one they left. The second day they were able to leave.
Okay.
So the critical case we had stayed in the hospital for 3 days.
Okay.
And the ministry has covered for all 3 of them, and they are all fine right now.
Okay. So just as we come to an end, the half-hour program goes by so quickly.
Yes,
But as we
yes.
come to an end, what would be your last message to St. Lucians on this occasion on the show?
Be patient and show understanding in terms of what is being done right now, which was not there because the service delivery is being improved. We are going to reaching you at your workplace on holidays during the weekend. So the ministry is doing everything that is in its possible to improve the healthcare system. So one of the main priority in healthcare is to improve your service delivery, ensuring that everybody access the service. Those who are working are not working in a place where they are flexible to leave.
Right.
The ministry goes out to them through health fairs at the workplace. Right now we have something going on at Sanders La Talk.
Okay.
So UHC is taking part to provide PSA screening. You understand? So, and one of the message I would like to pass on as well, Jade, we now on Friday, we encourage persons in region 8A, 8B, include La Clery, Bexon, Castries in advance, and Tiroche Castries, to visit Dr. Donny Glasgow for men's health clinic.
Okay.
So that's in Castries next to Dr. Frizzer's.
Okay.
So this Friday we're starting this clinic with Dr. Glasgow Lacking Decor. So we encourage persons to visit Dr. Glasgow for men's health clinic between 8 to 5 every Monday and every Friday.
Okay. Thank you so much,
You're very
Josue.
welcome.
I just want to quickly say good morning to all of our viewers online. Those of you who tuned in, thank you so much for that. Yeah, we're seeing a lot of positive. One person, Cletus Peter, said, I'm a survivor of cancer. Please take the cancer test serious, everyone. And like we said earlier, let me just run through it again. You have maternal and child health services. You get a saving of $1,130 baseline. That's just for the test. That's not the doctor's visit included, okay? But you save all of that, including the visit cost. Then for prostate cancer screening, people are actually saving $1,200. And that's amazing to me. For snake bite management, I didn't calculate everything, but it's a well upwards of, let's say, about $12,000.
Thereabout, yeah.
5 people this year have been bitten by the feathers. They all receive the care under UHC. So there are some individuals who will say, why snake bites? Why did you guys choose that? Think of the 5 people who may have
money
very
they
little,
save, huh?
yes, all of the money that they saved,
Okay.
and their lives as well have been saved.
Exactly.
And then, of course, we have breast cancer screening. We are, of course, in the month of October. Not only is it Creole Heritage Month, but it is also Breast Cancer Awareness Month. Take advantage of it. We encourage you all to go to your local wellness center. Take advantage of the services under universal health coverage. This is just one phase of UHC. UHC has 3 phases. This is one, the essential basket of health services: maternal, cervical, prostate, snake bite, breast cancer screening. Okay, so it's just one. When everything is ready, then you will hear about the next phase of UHC, and that next phase of UHC will encompass everyone nationally. And there will be more discussions on it. You will see our director, Dr. Alicia Eugene Ford, coming in to speak about it with you, and you will hear the facts, not the fiction, on what is actually happening, what is occurring for the health of the people of St. Lucia. So we implore you to educate yourself on the facts. So when you hear of anything else, you can say to yourself, yes, this can't be correct because I know what the facts are. I know what actually is happening with healthcare and the advancements that are happening with healthcare in St. Lucia. If you have any questions, please do contact us. We are Universal Health Coverage. We're located in the Sir Stanislaus James Building, Waterfront Castries. Give us a call, contact us, or contact your nearest wellness center for more information. Thank you so much for tuning in to PHI. Next week, we will be discussing the St. Jude Hospital. I'm no longer saying the St. Jude Hospital reconstruction project because we are in the commissioning phase of St. Jude Hospital. So we're well on our way. I'd like to wish you all a wonderful day. Thank you for tuning in, and goodbye.
It is well known that diseases like diabetes, high blood pressure, and other illnesses may restrict blood flow, which can lead to impotence and erectile dysfunction. This is why Enhance was formulated to meet these challenging health problems, which can reduce your ability to perform. If you're having problems maintaining your manhood, then reclaim your manhood today with Enhance. Enhance increases your energy level, boosts your stamina, and increases your endurance.
You can get your Enhance at Southwell VA4, Restorer Pharmacy Soufre, Knights Med Miku, Lay by Bar The Morn, Dexter's Place Jeremy Street Castries, Citygate Bar The City opposite the market, Plants Place Denry Highway, Arlette Supermarket Soufre, The Release Stress Bar Labrie Highway, Cool Joint Bar Victoria Schwazel, Prios Bus Stop 22, next to the Moshi Bus Stop opposite the Grosile Bus Stop. Prios Bar and Grill in Corinth, Grosile.
Enhance, the best a man can get.
Hello, all realists. Thank you for listening to Real FM. If you'd like to call our studio, here is the number. Call the direct line on 4533911, or you can WhatsApp call on 4879849. Call to participate, win prizes, request music, and interact with our announcers and DJs. Real FM, the People's Station. The People's Station.